News now. Tiny high-definition cameras have been changing everything from home videos to selfies and beyond.
But this new technology has legitimately revolutionized medical procedures. CBS 2's Dr. Max Gomez tells us a new camera may actually replace MRIs and even some surgeries, especially in the knees.
Yeah, that's right, Jessica. If you've ever injured your knee, it can be hard to tell exactly what's causing the pain. So the doctor usually sends you for an expensive MRI and then maybe an arthroscopy in the OR to take a look inside. But what if you could do a scope in the doctor's office, cheaper and safer? Lamushi Sufiani injured his knee in a car accident 2 years ago. Since then, he hasn't been able to play his beloved soccer because of the pain.
I can walk even more than 3 blocks. I have to lay down to sit. I have problems sleeping.
And 2 MRIs later, it still wasn't completely clear what was causing his knee pain. Liz Maris has also been having severe knee pain.
I can't get out of the car without cringing. It hurts to walk. It feels unstable.
Worse yet, Liz is claustrophobic in an MRI.
I don't like MRIs.
The next step is usually a trip into the operating room to look around by sticking a scope in the knee. Expensive and requires anesthesia. Why not do that in the doctor's office under local anesthesia? That's what this tiny scope with a high-def camera on the tip now lets doctors do in the office what used to take a trip to the OR.
I think it's huge. I think this is really a game changer.
With just local anesthesia, Dr. James Gladstone inserts the MyEye2 into Liz's knee. She's actually watching the same thing Dr. Gladstone is seeing. He can now check to see what and where there's damage inside the knee.
Almost as good as the operating room scope, and in many ways can be better than the MRI because it gives you direct visualization.
Better yet, if the damage is minimal, it saves the patient a trip to the OR for a conventional scope. And here's the best part. It costs under $500 to do this in the doctor's office versus $1,500 or $2,000 for an MRI and thousands more for an OR scope. Almost any joint that you can scope can be done with the MyEye: shoulder, elbow, wrist, ankle, almost any joint. You can do it this way.
Anything to avoid an MRI machine.
Yes,
those things
claustrophobia
are the
comes
worst.
out, right?
And you step outside and it's fine, but inside it's like
it's not
the
so
world's coming down on you.
Yeah.
Exactly.
We could go on.
You bet.
Thank you, doctor.